For many years, our members' top concern has been the inadequate staffing levels in their facilities with respect to delivering mental health services. We're here today to mark the filing of our requests with the Department of Managed Healthcare, and also to provide some testimony from clinicians who practice mental health on the front lines inside of Kaiser's facilities.
It's a sad and unfortunate fact that we have to be here today at the Department of Managed Healthcare filing a complaint because Kaiser has failed to heed the clinicians' repeated requests over decades to address inadequate staffing and inadequate response to patient care needs.
I'd like to briefly describe some of the findings of our report, and they are the following. Kaiser frequently violates regulations that require it to provide patients with timely access to appropriate mental health services.
Our patients consistently and repeatedly have to wait between 4 and sometimes up to 8 weeks for return appointments with a clinician, which is really a violation of community standards for care.
90% of surveyed clinicians report that there's insufficient staffing at their clinic to provide patients with timely return visits.
And what happens when patients wait so long for appointments is that A, they suffer much longer than necessary, sometimes getting worse in the time that they're waiting, and other times and very frequently at Kaiser, they drop out of treatment.
When you see them back every 4 weeks, you really lose the whatever gains have been made.
More than 75% reported that they are frequently or very frequently forced to schedule return visits further into the future than they believe is appropriate.
Time after time, I have seen patients who, had I been able to see them quickly in succession, would have recovered very quickly from maybe a grief or depression issue, who languish for maybe a year or more because of the length of time between appointments, suffering with whatever they're dealing with.
50% of Kaiser clinicians report that patients are either frequently or very frequently assigned to group therapy, even though individual therapy would be more appropriate.
There are even targets set. The one we hear most frequently is 25% of patients should be in groups, not because there is some clinical support for a 25% number, but because it helps them not hire more staff. Groups are really good for some people, but it is not the community standard and is certainly not for most people.
We just wanted to be here to support our social workers and also other mental health professionals at Kaiser who are concerned with their inability to deliver adequate and timely care at Kaiser because of the practices of that facility. We're also concerned with the patients and the delay in care, which often results, as Emily said, in those patients' mental health conditions worsening. And so we really want the Department of Managed Healthcare to look at these allegations seriously and to correct some of the abuses.
We feel it is absolutely crucial that the Department of Managed Healthcare take some action to address these concerns that we, the mental health providers at Kaiser, have been asking Kaiser to address for decades, really.
We are not serving the Kaiser members in the way that we could best serve them.